COVID-19 and its subsequent, plethora of reverberations and how it's affected how we live and function are just tremendous. I think when it comes to diagnosing and treating and managing ADHD, one of the most important areas, most impactful that I've seen is the fact that remote learning is pretty challenging for folks with ADHD, right? And so we're going to take a scenario where we've got some issues with focus and attention, higher distractibility, maybe restlessness, impulsivity, right? Off-task behaviors. We're going to sit that child in front of a computer and tell them to sit there, be quiet, pay attention, and do what they ask. And just, when it comes to attention, ADHD or not, physical presence impacts that, right? Being in a classroom with the teacher is automatically going to draw our ability to focus more. Now, if I'm at home in an environment that's not what I'm used to being cued to kind of to fall in line with the academic process, right? All of us tend to act differently at work than we do at home. At work, we have a structure on how we engage. We're more relaxed at home. And we don't have to remind ourselves that we walk into the environment, those things come together. Well, this is true of adults, kids alike, and then ADHD or not, but the impact is higher for folks with ADHD. So we have them in an environment that doesn't cue them. They're sitting in front of a computer, which probably has more distractions than a classroom, right? You can turn the camera off. You can pull up a game and have multiple things running at the same time. And frankly, computers are quite engaging, right? I have parents that'll tell me with their kids who have ADHD that, they seem to be able to get on a computer or a game for hours and it's no problem. And what I remind them is that when we talk about attention with ADHD, we're essentially, I'm going to oversimplify this, but we're talking about sustained attention to something important and relevant, but boring, right? We all inherently can naturally pay attention to things that are relevant or that we like. If you have a hobby, you could probably do it for hours. If I pull out a book, on archaeology, and that's not your thing, your mind's going to start to wander pretty quickly, right? That happens in all of us, but in ADHD, it's much more accentuated. So a video game or a computer that is constantly refreshing and dynamic and interacting, it's kind of a constant re-up of attention. It's kind of like if you hear a noise in the room, it'll draw your attention. That's not what we're measuring, right? And so that's why the engagement around technology and other things can be much, you can see that folks with ADHD can do that for a longer period of time. Interesting thing is, if you delve into the particulars, you'll see even their performance in that arena is impacted as well. So that's a long way of saying that one of the biggest problems with remote learning is we don't have the modifications or adjustments accessible to us. We don't have the person who can give the appropriate redirection or whatever the educational plan or the individual needs of that person. You can't affect that through a TV screen at home. Additionally, we have the kids are home, parents are home, many of them are working. So the ability to sit there through an entire day with a child who has ADHD to try to help provide that external support just isn't feasible. And so that's the biggest challenge I have seen. I've had families reaching out and saying, well, maybe the medicine isn't working as well as it used to. The reality is medicine's probably doing what it always did, but the level of attention that we need to do school and other activities this way is much higher. And then we also look at other external things, trying to make sure we have a space that's kind of cute, that supports academic engagement, has minimal distractions to the best of their ability. But that's been the biggest thing, and it's impacting. It's been a year, so it's really impacting the quality of the education they're receiving, what they're learning, and their ability to get support around that.